Inspiration without perspiration is a daydream, and perspiration without inspiration is a nightmare. Other for our shaman, Bia, Ubia, Meso say you and Shana on come over Bia Ubia. And preppy, a member be bree, and I go through a lot of health challenges. Notably among them is prostate enlargement. I can benign prostatic hyperplasia, and I say benign prostatic hypertrophy that may lead to prostate cancer. Now, as a health personnel, my name is Abuakun. I would like us to discuss and talk about what causes prostate enlargement. So stay with me. Yeah, prostate in Eden. But before I come to the prostate, the production of sperms takes place in your testes, and as a testicles or one sperms production it takes place. Now baby it takes place in your front the seminiferous tubules. Now every 1 second, seminiferous tubules na warehouse it produces sperms. It produces about 1,500 pieces of sperms. Now we produce almost storage area when a maturity of the sperms takes place. I refer what the epididymis. Into the production of sperms throughout their maturity takes about 64 days, and this process is known as spermatogenesis. Now, sperm production area, a point burn sperms transported from your testicles through sebio urethra na akoshe obano sebio ni woman who during sexual intercourse. That is when the prostate gland comes in. It's a case of prostate gland and no one for sopa. Now, what is it? The prostate gland is basically a walnut-sized gland that is located between the urinary bladder, which is and the penis, and in front of the rectum. Indeed, this is how the prostate gland looks like. Prostate gland in a shahano. It is located between the urinary bladder, Junsu channel, and the penis, and in front of the rectum, sebio oto babia sebio janai etano. It's a prostate gland in the shano. And sebio bema or testicles ayo shuanini. It is seminiferous tubes no ewaha. It is a sperm production it take place na a fat tube wim. A fat tubes we moi a friend of vast difference. A fat tubes we moi na kwa kufa o prostate gland in him. A foul prostate gland in my or the prostate in a beya mano. Na fidye a fat tube we are and as your friend the urethra. Na for my na foul penis a your bearmum. Then finally it gets to obano nase. So that is how the prostate gland looks like. Anatomical description of the prostate gland. Okay, what are some of the functions of the prostate gland? Basically, prostate gland or 3 basic functions. One, prostate gland it produces the prostatic fluid. And then in the seminal vesicle, and also it produces the seminal fluid. This prostatic fluid, seminal fluid, is used to kambuma. Now produce about 70% of semen. You can say semen and yet a pomema there be. Se bema uno bada na unba is used to na woman. Your friend is semen and yes sperms. Sperms won't mean for any unless you watch them under microscope. It's the other one who is semen. It's the prostate gland, one is seminal vesicle, and a cambunoma producing through about 70% of sperms of prostatic of semen into no banner the microscope as in your kosha. You don't miss the sperms, Nankasa around 5% per now about 20%, and so apakoye the prostatic fluid. Na seminal fluid is acquire about 70%. In the Kambuma and in Yasa 70%. Na sperms acquire around 30%. That is one of the basic functions of the prostate gland. Another function of the prostate gland in here, it prevents a man from urinating during sexual intercourse. One bema or no bad than no adjun soda. Ebia what tibida, but one intense. It is rare near R-A-R-E. It is intense. So the prostate gland prevents a man from urinating during sexual intercourse because a bit clampy or bladder sphincter no neumum ama sperms no through with the semen no afro. It is not likely to happen intensely by AC by intensity. So another function of the prostate gland no. And finally, prostate gland no and the velocity, the viscosity, as well as the strength and movement of sperms during sperm analysis. And that is another function of the prostate gland. So let's go straight to the causes of prostate enlargement. Nyankopon bo bema ne obano or mema hormones and ma hormones near chemical hormones they are chemical substances they are a word in pedium. It is a ma hormones, it be a progesterone, it be a estrogen, and our banosonium no be one so now it be so a form your friend the prolactin and then a man no funsu eba. Now bema dear ye hormones na androgens no did ya kutin wo mu pa aye testosterone. Into the testosterone is produced within the testicles or sure me one testosterone production it take place into testosterone no and a boa emma sperm production eba. Now the first cause of prostate enlargement aging. Bema biano se umfie ne ekosoro no from age 40 ekosoro you are liable of having prostate enlargement. Either say prostate no ebeye kesiye and as be shrinky into you are liable of having a prostate problem. Now once a unfin ekosoro no hormones na mabudien testosterone bebre esisa so that makes it another cause of prostate enlargement a hormonal imbalance. It is from age 40 kono na hormones no either say esote and a cosro. It is a hormonal imbalance a quite fast a cause prostate enlargement in you. Your enzyme bia your friend the 5 alpha reductase. So hormone na testosterone ne cosro 5 alpha reductase ya enzyme or be converted the excess testosterone to dihydrotestosterone because abroso it the moment as an enzyme no ebe converted the abroso to dihydrotestosterone pe na akoso prostate gland no go say ehut se balu na ye kese it aging and hormonal imbalance a panya a faso a causal prostate enlargement and a maturon. The third point are a causal prostate enlargement too much intake of meat. Bema na no ye ne del pe enam munu bebre bia o prostate ebe ye kese na kwan a o prostate ebe fa so aye kese eni answer na obewe na munu bia no agise heat akano in a form of say this ya noa this ya tuton this ya grele this ya chi and I say this ya ho kwan a obitima fa so awe na munu nie obi ani wa or faso ewe na mono raw sebio onye carnivore aboa oda in room to say lion mo we and na mono raw no enti the moment heat ebeka and na mono pe na BBSC na ye ready esi. Dr. Stephen Freeland, our director of the Center for Integrated Research in Cancer and Lifestyle, a year research and not discover cell. Se uwin na munu be bra heat akana a producer a give friend heterocyclic amine. Ne kase heterocyclic amine, heterocyclic amine kra eyedien. Heterocyclic amine is basically formed when meat is gotten in touch with heat. Now, when it's a heterocyclic amine is formed, it develops a powerful carcinogen potential when activated by cytochrome P451A2 mediated oxidation of the amino group, which is followed by acetylation or sulfation to form direct acting reactive mutagens that attacks the key element of DNA and the fulminate deoxyribonucleic acid. And ma brofo tintina makani nyina ehunu now. De me pese me kire nyina ne say wo wi enamunu bebra ma kire say da say be toton ye be noa ye be chi ye be grill ye be kono e for me ade bi wo nipadua my friend heterocyclic amine no ye powerful carcinogen ye ka say bi ye carcinogen ye cancer cells because enam mono bebre no ko ni paduama na produce a lot of cancer cells are activated by cytochrome P450A1A2 mediator cells na kwa attack o prostate gland no na mani huhu na ehunhunu na kese na fedi lead to cancer. It mesrem emema na through Saturday ni Sunday ni weekend na kai nya kotena ha nya jikiba kakra nya kotena nya ja confirm full and bear for mema bia no yom de menka se enam nye na mum wudi ne dodo a mesrew, you will get prostate enlargement. The next point of the causes of prostate enlargement is too much intake of alcohol. Too much intake of alcohol. One no sabibra affect o prostate gland. Na kwaya efaso affect o prostate gland in ye. Prostate gland no nutrient o hia pa bema nenya ahoden pa vitamins. O hia vitamins and o hia zinc. Na the moment obenom sabibra bia no alcohol depletes or cleans or wipes away the vitamins and zinc that is very good for the prostate gland. Unom sabibra and sana ekoriwe enyanunura ye zinc any vitamin and kebebo prostate gland na bon ho ba ma no wan yedi no na ensana koriwe sa anaso akohoro sa enyanunu ni nyina afiri ni paduanim into unom sabibra you are destroying your prostate gland. You will have prostate enlargement. Another thing that also causes prostate enlargement is masturbation. Bema or chichen hona no waba. Nyankopon ye na nyansani in such a way say bema sa wono oba have sexual intercourse. Na say bema no ehye na se a the moment a ho beba ube release usime ne pe naturally nyankopon kasa se enye duro na wafa naturally ubon se obema no ebedwo boko ebe ehye ba na ase na bon se ugusu ye na bon se wa release ya no bon se boko na adwo boko but o masturbate ya enam se obema no enhye oba na ase ni ntino o ho ba wie pe ubon se still obema ni gina so eyesa heat bi eba wa ya ase now causing prostate gland no na ama prostate gland no one say prostate gland cushion bi I say foam bi inti wa ya rubber ti heat can rubber den bon say ehuhuru na na nti more na masturbate na heat bi abi gina wa ya ase na wa ya ase shishish na cause the prostate gland na ama na huhuru thereby causing its enlargement which may lead to prostate cancer. It's masturbation and then coitus interruptus emema omone mada ne ho ba withdrawal method no atwe afiri mo no you are causing yourself a lot that may lead to prostate enlargement and can even lead to prostate cancer. Another thing that also cause prostate enlargement is untreated sexually transmitted infection, gonorrhea, which is caused by the Neisseria gonorrhea. Another thing is chlamydia, which is caused by the chlamydia trachomonas. Another thing is syphilis, which is caused by the Treponema pallidum. It is a human papilloma virus and a genital was an Indiacan. May they will call the anatomy of the prostate gland. Make sure say the prostate gland, no urethra, no, running through your prostate gland, urethra, no, connected to urinary bladder. It is said you winya and namu yari amabu na a back obema, said you obema, tube net them urethra na. It may forma na ko ujusu terminal when inflammation of the bladder cystitis. And I'm say and tube na so a bang na kofa prostate gland immunity no. And also it may call prostate name. Na some way could do prostate kwana. Na oma invade no ma di go prostate gland no ma bubo ntokrom na ma prostate gland na hono na ayekese because baby amwa be ko bia there is swelling na and ye kase when your prostate enlargement into unya enam yare bia be ma mesrew hwe treat. Other than that, it can affect your prostate gland and lead to prostate enlargement. Another thing that also cause prostate enlargement is constipation. People say, hey, na me tima be den na akọ affect me prostate gland me kyerɛ wade nti nyina yensu ade. Medical kyerɛ say the prostate gland lies between the urinary bladder and the penis. and in front of the rectum. Or rectum here, said you baby a janine, a store, na a foul to quiet anusum. Into prostate gland or thou rectum nenim pe, na me example be. Se uma yam tim bebra, sebu nyame a bony babiano, a full of tissue. Intino, we yam tim bebre, na say a jana beta or rectum ona, and I'm say prostate gland no or dan a nim pe nintin. A janine no etimi bu offer or rectum nimana pie, na a good ebiako baura or prostate gland in him. May example be what you say. One will say you two a form with your friend Abura, and I say, well, one will see a two Abura, yes, two toilet, and I say, mine hula toilet big boom abaneda. Who be so be almost there be yen two sanyaman you men. And yes, toilet and a befa assassin. Na ba na be good ensuing it was ensuing no man, a bemana poisonous, or better toilet in cow. Sana prostate no any rectum netie timo na woman wo yam atim no wo yam na etim no ene ne man ho no and I said toilet no and I mean say prostate gland no any enfomunsu abura no wo be hu say toilet no eno nom ko because omo bo ho pa talo ho eno nom fa wo tissues ni ma na akwa kogu o prostate gland nim because a jana so a toilet a jana toilet a poisonous itina sebiu ye yugo no it's in a kugu prostate gland nima. It causes the poison nature of the prostate gland, thereby allowing it to become inflamed or swollen, thereby causing prostate enlargement. Into be a woman young timubiano misrao. It can affect your prostate gland. And your kuku nkwana obinya hemorrhoids and nkwana obinya. It can also affect your prostate gland. It is please try and have a free bowel so that you prevent yourself from developing prostate enlargement that may lead to prostate cancer. Another thing that also lead to or that also cause prostate enlargement is smoking. Obia onum cigarette and I say smoky marijuana and tampibiano or say prostate gland. San smoking yemani nyina adibu ma nicotine. Na nicotine no e ko ni pediem they affect your prostate gland. Na ma prostate no ahono aye kese. Into no cigarette and I say marijuana and tampe. The more you smoke no, it affects your prostate gland. Na ma prostate na hono and it can even lead to prostate cancer because of the excessive smoking, because of the nicotine. Na a woman into no, say your prostate gland into the slow excessive smoking. No, you have to stop it. Other than that, your prostate gland may become very enlarged. Another thing that also causes prostate enlargement is too much intake of eggs. Ubi a udin kusia bebre, ubi udin kusia bebre. E kusia ye minka senye. So when me teaches be na make too much. The more you taking a lot of egg na nkasa no, e wo cholesterol bebre. Into a coso hypercholesterolemia. Now the moment ubina hypercholesterolemia, just a cholesterol ni prebiano mujama dosono. Na ama prostate na dwuma oye no ntimi nye pressure bedane so ubu se ehuru na ehunu na ye kese na ama prostate no aye kese na onya prostate enlargement that may lead to cancer. And I say egg nso owo adibi ma ye choline. Into the eggs are high in choline. Choline nso CHOLINE. Choline, the more it gets into the body, it affects your prostate gland. Now, my prostate gland now, it will be your prostate gland will become enlarged and inflamed. That can even lead to cancer. It's another thing that also leads to prostate enlargement and cancer is high intake of fat and oil. Prostate nanka so wuntinin kitin bia a supply ni moja any nutrients zinc and vitamins. It would be srade be prepare srade no potata wuntinin kitin na a supply prostate ni moja ni any nutrient no na cause ade be friend atherosclerosis, the position of fat and cholesterol within the arteries na sisi wo mo kwan inti moja intimi from any nnuane no intimi from enko supply prostate no ahoɔden moja nti ɔno so onya aduane ni obɛden ne bubefu ida se be shrink be mo aye ketekete anase be hono aye kɛseɛ it will build anwane srade niema bibrebia no prostate gland e be kɛseɛ nti mpacho so anagyan. Another thing that also affects the prostate gland too much intake of sugar sweetened and soda. Sugar sweetened and soda is sugar nearly be brave and soda can drinks no can also be so na chill carbonated drinks na one we are down pesani money be brave piano prostate gland and that can lead to cancer. Now the more you take in these things they affect the prostate gland because it is good for the body, but the prostate detests it more or when it is taken in excess. Who did this? Oh no, sad drink any sugar be prepared. So sugar ni na ecology and I say a season and supply prostate in point, thereby allowing it to become enlarged and inflamed. It in the cell. Yen teso and yes and mema sebi bema union bema timoni yen teso. Another thing that also affects the prostate gland a cause too much intake of dairy product. A case dairy product and one milk niane milk niane. Na kwaya milk niane efaso a cause prostate enlargement ni. Milk niane bebre ni say milk is high in fat. Milk na kasa sradi wom and a calcium sa wom. Into did milk niane bebre pe e cause adibi na say na ade no. Milk no ebe cause the proliferation of cancer cells through elevated insulin-like growth factor IGF-1, which is linked to an increased risk of prostate cancer. And my brother na makani now. Madika kasema kono srade bebre wom na calcium bebre wom. It more na wudia ko nipadua mo. Na cause proliferation just say a breedi and say increase cancer cells bebre due to the production of insulin like growth factor IGF-1. Na akwa attack prostate gland now na aye kesi ndu bia didi milk ni ani bebre bia na mesrew o prostate gland na eye kesi intimesrew tisomami iti niema mabobobo su nyina eye niema e cause prostate enlargement na obi bebisa say obobo sa niema we nyina so a e kwambe na mefa so hu se manya prostate enlargement. Signs and symptoms of prostate enlargement. It basically niema mabobo su na causes of prostate enlargement. It is do audimophobia and mesra say adabra kamensa da mseyem tete sa niema ni nyina so na prostate na anye kese. Signs and symptoms of prostate enlargement. First one, hematuria before or after sex. Hematuria before or after. Sorry, hematuria before or after. You can say hematuria. O Johnson na moja wum. Either say Johnson be moja ni be kamba. And I say what Johnson you know go say na moja e wachiri. Sign ma say prostate ni ya enlarged. The second sign and symptom urine dissection. What Johnson say Johnson ma pai mi you say sexually transmitted infections so it me manebasa. What Johnson ma pai mi you and also a sign say prostate no I can because medical culture say urethra no baby a Johnson fa eba no tube no a foul prostate gland it prostate gland ye kese a na amwa tube into wo so Johnson na Johnson ma pai mi you. Another sign a dribbling or spreading of urine. Bema wo Johnson or say Johnson kotinya na kogu faakon. But obi obenya prostate enlargement. You go so Johnson na spread it. Johnson na spread na apapa bebre na spread it. A sign say o prostate gland na ekesi because amwa o urethra tube no amwa no dribbling of urine. Another thing a feeling of incomplete urination. Or Johnson we are going to say ufili say onyunso we ne bia kam it is ankofo no or Johnson we are mo say ebi so e won the boxes na emu nyina for a feeling of incomplete urination. Or Johnson we are ufili say ebia kam because prostate gland na mo tube no enu ntia ma Johnson nyina antina ma adia eyo mo cardinal sign a frequent urination especially at night omo manya prostate enlargement no kakrebia no mo Johnson frequent urination polyuria, frequent urination. So polyuria I make I don't see a sign of diabetes. It is only diabetes now. Frequent urination. Yeah, also call it PSA test, prostate serum antigen test. Na alarm answer. Another thing is severe pain and swelling at the fanistle. You can say fanistle wayasi scientifically. Wayasi ni dino no fanistle. Eya na eho anhu na eho ye na unya pains wayasi na pains ewo ho pa and also a cardinal sign of prostate enlargement. And pain or burning sensation during urination. Pain or burning sensation during urination. Or just na ni bemani mu yani ya. Or just na ni bemani mu shishino. Or just ono ba da kra na no ba. Na ni bemani mu shishino. A painful ejaculation and also another sign and symptom. And blood in semen. Ono ba dana se na ho ba na mo jafra. Ai ono ba dana se na ho ba na mo ja efra. And also a cardinal sign of prostate enlargement, and I said prostate cancer. And frequent pain or stiffness in your lower back, hips, pelvis, and area apart of the thighs. Now, thighs, no so no wayas. Yasi, any deba wachinu wayasini na pains. It won't sense and cheniyama bossy na wako diagnostic center biano could wakoye PSC. Test, prostate serum antigen test, and as well could just scan. I'm mom say, so prostate na enlarge and then ruby or mote amount. Na uko nasa ukoye prostate test na. If you know it no oye test na see na ranges nitem. Normal PSA test is 0.0 to 4.0. We test na between 0.0 to 4.0 nanogram per milliliter per. Now prostate gland no normal. Na from 5 to 15 per na prostate gland no kese hono ba. Say 15 to 50 per na say ahun aduru empempeso bi. Na 50 to 100 per na say aduru cancer. Na 100 and above per it may spread it bones. Na monya bone cancer. Osteocarcinoma. It may spread it. They call mojam wanya leukemia, cancer in the blood. It may spread they call liver wanya hepatocellular carcinoma. It may call kidney moon na wanya kidney cancer, renal cancer. It may spread they call wide dream be anti yension na yension so. Now much change no. I deal with the camera and I didn't and I see me this year and my your bonnet. You were in me and be a udia a boy prostate gland pa into me bosso. The kind a salmon fish, yeah, salmon. It is very good for your prostate gland because salmon sradiana a high in omega-3 oil. And yes, sradibia na bad. Salmon a omega-3 oil bia a poor or prostate gland in 2 types salmon or prostate gland no a benya mountain. Ubia or ta and I say with this strawberry and non-strawberry drink biano and also a brown prostate gland no and now uta and green tea and also a brown prostate gland no and I feel so in toast Lycopesicum scolanum Lycopesicum scolanum in toast the botanical name no Lycopesicum scolanum in toast and also a bois or prostate gland palm. I mean, I give you. One say, O cover bia, your tongue and numbia, and I say, O call a beggar, and it's a shop and take care, Simone pizza, man. One say, O year, number we are no mamma, tomato ketchup be. Ancient scientists even say, tomatoes are debut, na natural. Tomatoes are debut. It's enana or in a beha prostate gland. And tomatoes name mawakan na canta and namno. Said the uncle also prostate enlargement. And finally, Rosa sinensis adodona, a friend had biscuits list, and I say subulu. Hey, Mrs. Subulu need tomatoes dear. See the see yellow. It's bema beyond person prostate gland, a bema casino lead to cancer. Tardy in toast not town so and no subulu. Now, some those so bully a one me point no a wapa adentina a preventing prostate cancer. And those any so bulu I did you my friend lycopene no omoye antioxidant bia omo pam ana so omo drive cancer cells nyina to tanum so bolo na udi tomatoes a prostate no enye kese nti ba bia wo hwe me bia no enne ade a me pese yesua eye prostate enlargement, benign prostatic hyperplasia, benign prostatic hypertrophy that may lead to prostate cancer and machirechiro enema edeba ene kwanya be faso ahu ensenchene na be me yehu ni bi ene enema yedia itimi boy prostate onum green tea boa wo udi ntos bi bra eboa because of lycopene wom onum so bulu bi bra eboa because of lycopene da wo cancer cells ni nyanya prostate enlargement kwa wo your back breast cancer wo tanu so bulu wo like ade be cancer bi be wo ni nyina free and salmon so because of the omega 3 or your na wom and na strawberry so and so go lycopene bi eti ba bi a wo hwe ni bia sa wo do nua be ma bi wo your bounce na wo do nua be ma bi na so wo do kuna video yi wo send ya ma no so hwebi no so abon mo ban and bema nyina eno bema because se wonya prostate enlargement ne could lead to cancer ye your prostatectomy hwe awrawo seme wo ye be you prostate gland ni nyina ye nyibinya biu ye yi prostate gland no one na accessories nte ye phone na ene ne charger ne earphone ene ne mouthpiece ni nyina be say ye be you prostate gland ne seminal vesicle ni nyina nti bema sebi me can plane any plane fa one obemba no bedjo enye adwuma bi so obemba be ye adwuma so pa untimi release sperm bi because sperm is you to na obeba be fa sperm no e de na nantina ye seminar fluid and prostatic fluid no ye yi omu nyina akọ eti bema obewu se ko no oba eda o hwe no de se bi obe produce sperm so no all right but if I did dry orgasm who produce sperm and as no bad that pen prostatic fluid ne seminal fluid na kebeba be fast sperm ne do ma kon any honint no who was sperm na sa arere akogu ohwe ne biem eti produce wo warehouse or seminiferous tubes on akogu epididymis wo as yini na no ba ne da na ho beba be sperm no kwa wotimi nanti nso tototo na kebeba be fa na kon nso no ye yi omo afi honint nso ne ma na sperm na asa arere na akoti bema ani jide de we pan as a bowa na okoya na se buy eti yentie na yenhwe yen sendima obi ni na yentu yemfo baby a obi a message say you will shine on count. Your health is your wealth. That is why I always say my health my treasure. Shalom, peace, bye bye.